community health workers going to need to know how to respond to the pandemic. And so I came back and I emailed about 5 colleagues and I said, do you all have a presentation that you can put together in the next week that's tailored to community health workers? And all 5 of the women were like, sure. And in 2 weeks' time, we did a 5-day free virtual summit for community health workers to help prepare them to respond to COVID-19. Of course, just sharing what we knew at that time, and we know how things were changing every week. And I said to myself, I said to the ladies, if we get 100 people, I'm happy. If 100 people sign up and come, I'm happy. And we had almost 800 people. It was like 760 something sign up. I remember my email list went from like 40 to 800 overnight. And when that happened, I said, I found a niche. I found a niche.
Welcome to Public Health Careers. I'm your host, Umari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to episode 126. My name is Umari Richards. Thank you so much for joining me. If this is your first time tuning in, be sure to hit that subscribe button so you stay up to date with this great content. Also, please leave a like, leave a 5-star review, and share this with someone who gets some value from it. It really helps the show get out to more people and expands our reach. I enjoyed today's conversation with this nursepreneur and public health consultant. She's a nurse who transitioned to more public health and entrepreneurship work, as you'll hear about in her story. You'll also hear through her journey, she identified gaps which led her to start 2 organizations, one around addressing the lack of diversity in diabetes care and management, and one around the need for training of community health work instructors. If you're interested in public health entrepreneurship or want to transition into public health, this is a great episode for you. Enjoy. Today, we have someone with experience as a nurse, public health professional, and someone that took the leap from corporate to entrepreneurship. She got her associate in nursing science at the University of Arkansas, Little Rock, before working in nursing. She then got her Bachelors of Science in nursing at the University of Phoenix, and then went on to get her Masters of Public Health at the University of Arkansas for Medical Sciences. She is the CEO and principal consultant at Umemba Health, LLC, while also being the president and co-founder of Diversity in Diabetes. We have Quisha Umemba MPH, BSN, RN, CDCES, CHWI. Welcome to the show.
Hi, Omari. How are you?
I'm doing well. Trying to get through your mouthful of acronyms that you have behind your name.
I didn't know you were actually going to read those out, but I appreciate it.
I read it out because I feel like some people don't know what certain things are. And I feel like it's cool to see different things because it shows you that there are different types of educational sets or degree or certifications that you can get to really stand out in a certain area of work. And I'm interested into getting into that CHWI, which we will a little later in the interview.
Absolutely.
So how are you doing and how have you been coping during these times?
I'm well, and I think I'm coping well. As we'll get into it in the show, I've been a full-time entrepreneur for 12 weeks today. And so it's a really exciting time and a new transition for me, but I'm coping extremely well. Thank you for asking.
Well, that is great to hear. And yeah, I'm looking forward to getting more into your head around that, as it's so fresh for you to be in this work. So tell us, how do you identify? And then tell us a little bit about your personal background.
So I identify with she, her pronouns, and if that's what you were asking. But then as far as, kind of the hats that I wear, I've just recently in the last week decided I'm going to go with 2 titles. That's nursepreneur and public health consultant. And that was probably after about 3 years of, people will say, Quisha, well, what is it that you do? And, on any given day, I'm a mentor, trainer, coach, instructor, facilitator, and the list goes on and on. But I identify as of right now as a nursepreneur and primarily a public health consultant.
Okay, I love that. I haven't heard that term nursepreneur before, but let's go with it. And before we get more into your nursing career and your nursepreneur career and your public health career, what does public health mean to you?
Oh God, that's such a loaded question. Um, Public health has to do with everything. I guess for me, it is the sum of all things health as it relates to individuals and families and communities and society at large. And really it is everything and has to do with everything.
Now, a quick break from our show sponsor. Have you been interested in connecting with a community of people who are passionate about community health while working on improving their own personal well-being? Well, lucky for you, the Community Health and Wellness Discord server is where you want to be. It's a free online community I co-created just for people like you. You'll find friendly people talking about important public and personal health topics, asking amazing questions, sharing valuable information, while connecting with each other to build a better culture of well-being personally and at the community level. Join this free online community by going to thephmillennial.com/join. That's thephmillennial.com/join. See you there. Now back to the show. It absolutely is. And yeah, it encompasses so much. And I feel like if you throw out a definition of public health, some part of it is probably going to stick. So definitely appreciate that.
Absolutely.
Yeah.
Absolutely.
Okay, and you began your collegiate career getting your associates in nursing sciences at the University of Arkansas at Little Rock. So tell us a little bit about that thought process of going into schooling.
Yeah, I think like most nurses, I originally, in high school wanted to be a doctor. I got married at 18 and had my son at 18. And so the trajectory of my plans changed significantly. I started out as a medical assistant and well, started out as a candy striper in high school and then went on to be a medical assistant, graduated valedictorian from that program. And one of my instructors said, you really should go on to nursing school because, there's more for you. Just don't stop here. And after that, I was a mom. I always tell everybody I've never had the traditional college experience. I've always been a wife, a mother, worked full time, and went to school. And so I kind of stair stepped my education the entire time. So I started with my associates in nursing. And then I went on to get my bachelor's after working a couple of years. There's always I take a couple years off and then, work full time and maybe work a job and a half because that's just the type of person that I am. And then I go back for another program. And so then I went on to get my bachelor's in nursing and then another 2-year break and then on to get my master's in public health. But that's kind of the journey that my career has progressed through.
Well, that certainly is very impressive, first of all, and I'm glad that you're like highlighting it just to show that it is possible, and that I'm guessing that it was challenging in a lot of aspects, but at the same point in time, you were like, okay, I'm working, let me go back to school, let me get this education, let me go back to work, let me go back to school, let me get this education, and it seems like you've because everything that I do see from you on like social media and everything like that, it seems like you've really reached a point in your career where you feel very fulfilled, like especially in this entrepreneurship, nursepreneurship field or space that you're in. So that's awesome that you're able to do that. But just to say, and it's possible.
It is possible. It's possible. And also, for me, a lot of times I look at situations and say, why do I have to go through this? Why do I have to work and go to school at the same time? Why am I starting my business and working full time at the same time? And when you're in it, you don't really see that you're learning how to manage multiple competing deadlines. You don't see that you're learning how to juggle, master time management and juggle so many different things. But when I look back over everything I've experienced, I'm like, I wouldn't have had it any other way because there would be no way I don't think that I would be in the position I am in if I did not have those experiences that led me here.
Absolutely. The bigger the obstacles, the bigger the learning lessons, the bigger the experiences are that you can get to translate into the work
Yeah,
that you're doing now. So
absolutely.
that's great.
Absolutely.
That's great. Okay, so after you got your associates in nursing, you started to work as a nurse, and you were a staff nurse in the surgical ICU at Central Arkansas Veterans Healthcare System. So tell me about that thought process, like transitioning from your associates into actually becoming a nurse and working.
Hated it. When I left out of school, I said, I'm going to go to the ICU and I'm going to be a real nurse, because my mindset then was, if you go do something very hard and very demanding, then you're like the top of the top. And again, I'm still, kind of kicking myself because I didn't go to med school, right? And I went there and I absolutely hated it. I worked in SICU for a year, and it wasn't necessarily the nursing work. But it was what I was becoming. It was working with surgeons that don't have the best bedside manner. It was working with seasoned critical care nurses that tend to eat their young, which is a saying that if you work in the nursing field, you hear that. It was not having much interaction with family, because when you work in ICU, and plus I was working nights, you don't really have much interaction with families. Depending on how sick your patient is, you don't have much interaction with even the patient. And so it becomes just very technical drips and machines, and and for me, it didn't give me the fulfillment that I needed. And so I quickly realized this is not the type of nursing that I wanted to do. And I transitioned to long-term care and did that for several years. And that's when I decided, I don't think I'm going to be a floor nurse for the next 20, 30 years. I should probably look into getting my bachelor's. And I had a nursing instructor that said, Quisha, you'll make a great manager. You'll make a great nurse manager. And so as much as I dreaded now I love middle management, absolutely love it. But as much as I dreaded the thought of being over schedules and filling, positions when people called in and all of these things, I knew I didn't want to work the bedside for an extended matter of time. And so I decided to get my bachelor's of nursing.
Okay, that makes a lot of sense, and I'm guessing that's like a little bit of the disillusionment of like the medical system and how it's set up. That you're not really having deep relationships with patients, but more so just doing those technical tasks that you're seeing. So going into your bachelor's, and you got your bachelor's of science in nursing at the University of Phoenix, was it that you knew that you didn't want to be a bedside nurse, but you were aiming to become more of that manager as that mentor or person shared earlier? Or what was that thought process going into this bachelor's degree?
That was the thought process going in, and that immediately changed probably in the first semester when I took a community health nursing class. And so in that community health nursing class, one of our assignments was called a windshield assessment, where we would drive in a 2 mile, I think it was 2 or 5 mile vicinity of where we lived. And we basically had to take note of anything any public health related issues. And so I was in a brand new subdivision. We just moved into it. And there were no sidewalks. There was a lot of construction. I was constantly blowing my tires on nails because they were building new construction. There were no bus stops. There were dogs running around on leashes. And so I did this windshield assessment for this particular class. And I remember pulling over and like flipping over the page because there were so many things that at the time I just assumed they were public health related issues. Once we talked about it in class, then I got to understand. And that was really my first introduction to public health. And after finishing, and again, like I said, I always do I was getting a degree, working for a couple of years, and then getting another degree. And I remember telling a friend of mine, she was an endocrinologist, I don't really think I need a third degree in nursing, because I'm a plan A, plan B, plan C. And with nursing, you only have job security if your nursing license is untainted. Not to think that I would have ever done anything that would jeopardize my nursing license. I'm just a planner. And so I always felt, well, what if I move somewhere, another country, and my license isn't, it won't transfer? What if something happens and I have 3 nursing degrees, but I can't work as a nurse? And so thinking about everything that I learned about community health nursing during my my BSN program, and then thinking about, I really need to get another degree, but not in nursing. And then I noticed I started seeing, again, because I was still following doctors, right? I had a lot of friends that were in the medical field. I started seeing MD, MPH, MD, MPH. And so I talked to my friend, what is this MPH? And so, long story short, after, researching programs and really thinking about it, that's when I said, you know what, I'm going to get a master's in public health. I think I'm done with my nursing degrees for right now.
Okay, that makes a lot of sense, and is not unfamiliar story or train of thought, or like where people find out more about like this public health thing is seeing other people with the degrees and say, oh, okay, what's that? How can I like incorporate that more into my work?
Yeah.
So during your bachelor's program, you you had this community health nursing class, which is a little more focused on public health. Did you have any other classes that kind of pushed you to learn more about the public health work, or was it just that in the work that you were doing full
Not for
time?
the BSN, not for the BSN. We touched on public health, but if I can remember, there was more of a focus for population health. But not for the BSN, not any classes that stand out to me.
Okay, that makes a lot of sense. And then in considering that you're trying to do something different, or like try to make sure that you're secure all around, knowing that you might want to nurse in this specific place and there might be barriers to working, whether that's another state or another country, you wanted to get another degree, and you saw the MD MPHs. Did when you looked into like getting a graduate level degree, did you look at other programs outside of MPHs? Because I'm guessing that being in nursing, you probably heard about MHAs a lot. So I just wanted to hear like if there was any thought process of any other
Yeah,
degrees and why public health.
that's such a great question. I did look at MHA. I looked at MPH. I looked at MSN, Masters of Science in Nursing, with a public health concentration. But I'll be honest, let me tell you how I narrowed down my decision. I'm not even going to lie. I'm going to keep it real with you. I did not want to take the GRE. I did not want to take the GRE. Math has always been a weakness of mine. Okay, so this is a fun fact too. I originally was not going to be a nurse when my instructor, my medical assistant instructor, said go to nursing school. Again, because I was, in the mind frame, I'll just stair step since I have to work full time. I originally tested to be an LPN, a licensed practice nurse is what we call it in Arkansas. In Texas, licensed vocational nurse. I did not pass that test. I missed probably like 3 questions in the math section. But because I'm hard headed, I was like, forget this. I don't want your program anyway. I'm going to go be a registered nurse. So that's how I ended up being a nurse. So knowing, and I was diagnosed with math anxiety because I almost didn't get through the first semester of nursing school, but I got on meds and help and all that stuff. So for me, I knew I could not take a test to get in. And so I actually attended the University of Arkansas for Medical Sciences. Is a public health certificate program, or was at the time, where it was 12 hours and you could change your mind after the first semester if you got a certain, like over a 3.0, and say, you know what, I think I like this. I think I want to go ahead and do the full MPH. And so that was the determining factor. Again, I'm keeping it real for why I decided to go to UAMS, because they had that, they had that easier way that I could get into the program without having to take the GRE.
That self-awareness is key. I think like knowing that that is not your strong suit, but knowing that there are other avenues to make it into a program. And I think that is still true for many programs out there, that you can start off with the certificate and continue into to get your full master of public health. So that makes a lot of sense, and very resourceful on you. And and I always say, like, all those opportunities that close the doors on us, it just opens up other doors. And as we see, you've gotten your MPH. Okay, so you decided to get your MPH at University of Arkansas for medical sciences. Did you have a concentration?
Health behavior and health education. I knew epi was out of the question. I knew biostats was out of the question. Again, too much math. I don't know what it is about math. I loved it till they put letters in it, and then after then it just kind of went over my head. Yeah, health behavior and health education. I think particularly for me at that time, I had worked. I had just become certified as a diabetes educator. That term is now certified diabetes care and education specialist. I was doing a lot of motivational interviewing with my patients and clients. And I was really interested in why do people rather participate in their health versus those that are not participatory or that do not participate in their health. And even, at the time, I think around the time my dad was diagnosed with type 2 diabetes as well. Um, he's a teacher. I come from a family of teachers, educated. But I realized that, okay, he's educated, but when it comes to health literacy, he's severely struggled. And so for me, that just seemed to be the best fit. I was already a nurse educator. And then I thought that that would make a lot of sense. And it did marry very well with health behavior, health education.
Yeah, that absolutely makes a lot of sense, and it seems like, and just to ask, like during your MPH, you continue to work as a nurse during this time.
I've always, yeah, yes, absolutely, absolutely, yes.
Okay, and was it type of nursing? I actually, let's walk back a little bit here. So you shared a little bit about motivational interviewing, and you said that in specifics to diabetes prevention. So can you talk a little bit about what motivational interviewing is and how you use it around diabetes prevention?
Yeah. So at the time when I applied and started my master's program, I had left the long-term care floor that I worked for about 3.5 years, and I was now the care coordinator for an endocrinology clinic. Endocrinology is one of those topics. I went to nursing school and I did not like it at all. And so when I went there, again, I just got my BSN, right? I'm looking for management opportunities. So I went to the clinic. And when I got there, I thought, oh, I'll deal with a lot of tumors and growth hormones and different things like that. And didn't realize that 80% of my patients would have diabetes. And so I realized that was the interaction that I was missing in SICU with patients and with families. I completely got that as a diabetes educator. And so, to answer your question now, motivational interviewing is a technique that you use when you're working with clients or patients, specifically on health related topics. And so it originally was developed for individuals that were addicted to drugs or alcohol as a way to help them to get off of drugs and alcohol. But now we apply motivational interviewing to just about anything, especially in the realm of healthcare. And so it uses a number of different strategies to build rapport and build trust with clients, to really help them to move toward making their own decisions, assessing their comfort level, assessing, not comfort, confidence level, assessing their motivation and capacity to do those things. And for me as a nurse, and it's not just for me, nurses in general, and I think helping professionals in general, we just want to fix stuff. I was the type of nurse before I was trained in motivational interviewing and some other techniques as well, where I tied my self-worth to whether or not my clients, my patients got better. And when I learned motivational interviewing, it really took a lot of that stress and that burden off of me, because made me realize that yes, I have a patient that has type 2 diabetes, and he's 100 pounds overweight and his A1C is not managed well, and he needs to lose weight among other things as well. But he doesn't necessarily want to lose weight to get his A1C under control. Oh, but guess what? His daughter's wedding is 6 months from now. And now he's coming to the clinic because he wants to make his daughter proud and look good, walking her down the aisle. So it's kind of helping them come up with their own motivations. And behind that is when you'll start seeing the improved health outcomes and the behavior change.
Yeah, absolutely. Thank you so much for describing that. And yeah, when I heard about motivational interviewing during my MPH program, I just thought like this is really a great resource because it is or I should say tool, because it is, as you said, it's not, you might think like this is important, but to them, who cares?
Mhm.
Who cares? It's like really aligning the health positive behaviors with motivations to them. Like for example, as you said, the
Yeah.
wedding, or whether that's they want to play with their children or their grandchildren, and just saying, okay, well, if this is something that's important to you, then we should do these things so that the chances of you doing this are increased, etc., etc. But I love that you
Yeah, I mean,
described that.
it's meeting the patient where they are, right? Which is what we say in public health all the time. It's truly meeting them where they are.
Yeah. And were there any other takeaways that you had during your MPH program?
During the program, takeaways. So I will say afterwards, I went to work for a health department. And the one thing that I will say about my MPH program, and I tell this to students, everybody, my degree is the MPH, I believe, is the only degree that if you then go and work in public health, whether it be state, local, federal, whatever, you utilize every single skill that they teach you. I can't say that about nursing. I have friends that, we all come from different professional backgrounds. And everybody's like, oh, I took that class for nothing. I took organic chem, this, that. But for me, the MPH, I have utilized every single class that I took when I was there. I don't know if there's any takeaways. I would say for me, it was important because I wanted to be well-rounded. As much as by that time diabetes was my specialty, I tried my very best whenever I had a paper to write on, or when I was doing internships, or there was some extracurricular activity or project. I would not do anything diabetes related because I didn't want to have a very limited view of public health just from the lens of someone with expertise in diabetes. So try to get a varied experience and varied varied experiences there.
Yeah, I love that. And I think that if anything, the Master of Public Health just teaches you a new way to think about the world around us and approach it. And then it gives us the tools to apply it to different circumstances. And I absolutely agree with the point of if you're doing all this diabetes work, or whether like that's in your job or whatnot, why not learn other topics and like use the same skills and tools that you're building on to, whether that's writing your paper or present on it or just learn about it, because I think that that's what the MPH is there for, and it really is catered to what you want to do. And a lot of the projects you can choose the type of topics that you work on, which is something that I enjoy about it.
Oh, I do have a takeaway, Amari.
Mm-hmm.
I remember saying this to myself when I got my first job out of grad school. So for me, and again, because I try to avoid anything that has to do with numbers, I didn't put as much emphasis or spend as much time learning evaluation. I was very much into program planning and the implementation aspect of it. I still love both of those. My first job out of my MPH program was chief nurse in the Office of Chronic Disease and Prevention at the Houston Health Department. And so I was tasked with running a couple of programs. One was the diabetes program, the other was colorectal cancer. And I think about 6 months into it, I remember saying, oh crap, I should have paid more attention when we were learning about program evaluation. So I had to lean heavily, on the program analyst and the evaluators and things like that. But I do remember every time I had an intern that would come in that was in their first year or second year of their MPH program, I would always tell them, there is no program if you're not able to do a good evaluation and show your funders, the impact, the reach, etc. So don't just solely focus on program planning and program implementation. The evaluation is probably more important than the other two. So that is the takeaway. I do remember that. Yeah.
That absolutely makes sense, because at the end of the day, you need the evaluation to see if what you're doing is actually working, or if you have to change the entire program. And if you don't have the evaluation, you never know. You never know.
Yes, absolutely.
Okay. So then coming out of your MPH, you became that chief nurse at Houston Health Department, and you were over diabetes and colorectal cancer. How did you come across this role?
That's a great question. 8 months before I was graduated. So I graduated in December. I want to say it was around April, May. I told my ex-husband at the time, I said, we're gonna have to leave Arkansas. I was working as a nurse for the VA hospital, which I don't know if you know anything about the VA. They're federal, they pay very well. And the health department there, if I would have went into a position there, I would have actually taken a pay cut. And so I started looking early. I said, we've got to leave Arkansas if I'm going to stay in public health, if I'm going to get a salary, that I think I deserve. And I think I applied for a job with the CDC in Atlanta, which I didn't get. I don't know why I thought I was going to get it, but hey, I went for it. I applied for, I can't remember, there was one other position, and then I applied for that position and did a couple of interviews, and they were like, you're hired, but we can't wait till December. So you've got to come down here. Luckily, I was already used to working full time and going to school. And so, yeah, I had to finish grad school and move and sell a house and a whole bunch of other things, and then start my first position in public health. It was a very um, exciting time, among many other words as well.
That is truly amazing. And one other question about your MPH. How did you balance all of that, like your MPH, working, a family life, all of that?
Support. So I definitely had spouse, had family, parents, siblings that watched the kids and made sure that they were taken care of. I went where I worked, the VA hospital was connected by a tunnel to where I went to school. It's a teaching hospital, UAMS in the VA. And so I would get off work and then take the tunnel and go to my evening classes. But all of my classes were not in person. I had probably about half of them that were virtual. And then I also had a really good supportive supervisor. Like my boss and my boss's boss, they knew that I was a student. In between checking in patients, in between doing things, they allowed me to sit at my desk and do my work. So I will say that's one thing I've kind of been fortunate in every step of the way. I've always been able to do my schoolwork at work. I was a night nurse for the first 5 or 6 years, and so at a certain time the patients are asleep, and that's the best time to open up a book, read, study, and do your assignment.
Yeah, that makes a lot of sense. And yeah, support is very, very important. And in your chief nurse role, your first role in public health after you graduated, what are the type of things that you had to do?
Okay. I had to write grants. um, I had to do technical reports. I had to hire staff. On day one, I went into my supervisor's office, and we were going over the very introductory things. And then she's like, these are the immediate things you have to do in the next 30 days. You have to hire 2 CHWs. And I said, come again? What? I'm sorry. What is this? Because at that time in Arkansas, we didn't have CHWs. And I said, what is that? And she said, it's a community health worker. And she gave me like a 1 or 2 sentence snippet, but I was supposed to hire 2 of them in 30 days. And so
Mhm.
that was and I know we'll get to that in a little bit, but that was my introduction to community health workers. But that position, I just hit the ground running, and not in a healthy way, right? You got a new position, you're in, middle leadership, you're trying to make a good impression, you're new to the city, put in a lot of long hours, but found out that I love being in a position where I am the kind of the mediator and the communicator from senior leadership, um, to that direct line to the boots on the ground. I absolutely love managing. I love my team that I work with. But I remember having to tell my supervisor on a couple of times, you do remember this is my first public health job. And so she said, oh, Quisha, I forgot you're coming from the hospital. So there was a learning curve, but I put in the time. And I mean, probably 12 months, I was with it. Yeah. And that's also because when I got kind of, I'll say, started thinking about entrepreneurship, because I was at a point where I was managing so much that I thought I could probably do this for myself with less levels of approval and red tape. But that's a conversation. We can get to that, or we can just leave it there.
Yeah, that absolutely makes sense. And I remember earlier in the interview, you said that you had this mentor, this person who was saying, Quisha, you really should be in management. And then you went on to get your MPH. and now you're in a role as a chief nurse, which has management responsibilities. How did you develop that management skill throughout this time? Was that through your MPH, or was that through other trainings, or how do you develop that?
That's a great question. So before then, I had only managed, well, as a charge nurse, you're kind of in charge of the shift, right? The patients on the floor for that shift, the nurses on the floor for that shift. So I had that experience. As a care coordinator for the endocrinology clinic, I had managed two individuals before, the front desk staff, the schedulers. So I had a little bit of experience there. I knew that this was going to be completely different. So I read books like Stephen Covey. At the time, actually, a year after I started the health department, I started a doctoral program. So I went to school for 1 year to get a doctorate in strategic leadership. So I was doing a lot of studying and reading on, organizational change and leadership theories and different things like that. Because that's very much my personality. Is just, I like to say I have a degree from YouTube Community College and Google University, right? So I start there. But I also knew that I wanted to be everything that the bad bosses I had before were not, and everything that the good bosses and supervisors that I had were. So there was a couple of things that I implemented immediately. One was bi-directional feedback. And so that would mean I could talk to my staff about things that were either positive or negative, right? Or neither. But then I also allowed them to tell me, like, Quisha, this is not cool. Like, we don't, why does this person get to go to this training and I can't go? And then the other thing I had, which I don't always recommend, was an open door policy. And so, but that's something you don't learn until you do it. If you have an open door policy and you have 15 staff, then you do most of your work when you get home in the evening. And so, that's something that I started and I actually did not end, but had I been, if I had the opportunity to do that again, I probably would have a set hours where I would have an open door policy.
Okay, that makes sense, and yeah, I could imagine the learning curve in that as well, like being your first public health job and then being a manager or a leader among people, and that also having to take like notes from the management above you and then conveying those messages to the people that are underneath you. Is not easy, but kudos to you for taking those steps, really put yourself in a position to thrive in it.
Thank you.
You're welcome. And you were also a volunteer for the Peg Adams peer-to-peer program guide at the National Association of Chronic Disease. So tell us a little bit about that experience.
So that was during my time at the Texas Department of State Health Services. I worked there as a diabetes nurse consultant. That was a volunteer position that you can apply for. And so basically I had mentees across the US. I believe there was 6 of them that were implementing diabetes programs or diabetes prevention programs. And since I did that for 5 years at HHD before going to the state, I was a mentor for those organizations that were trying to implement and come up with funding and address barriers and challenges, help them with things like recruiting, retention, program evaluation, so on and so forth. And so I did that for about 6 months before I had a very, very short stint at the Department of State Health Services. I was only there for a year because there was a conflict of interest with my public health consultancy.
Okay, well, that's interesting, and we'll get into that in a little bit. So you said that you worked as a diabetes nurse
Nurse
consultant
consultant.
after being a chief nurse at Houston Health. So what did you
Yes.
do in this role as a diabetes nurse consultant?
I loved it. I loved it. Didn't love the state. Again, we can get to that in a little bit. It was my first time working. So by then I'd worked feds, the VA, and then I worked local health department. And so this was the first time I worked at the state. As a diabetes nurse consultant. Again, I spent 5 years basically developing not just diabetes programs. Our diabetes program, or our diabetes center, we went on to develop hypertension program, smoking cessation, stress management, a number of different nutrition programs. I mean, we developed so many chronic disease programs. And so again, like I said, that's kind of my jam: program planning, implementation. That's where I'm at. And so that's what I was tasked with doing with as a diabetes nurse consultant with the state, with several organizations throughout the state of Texas that were in different areas. Some were, just starting or thinking about getting their program started. Some had already been established for some time. Some were trying to get accreditation or try to start billing for Medicaid. And so it was fun. Yeah, it was again when I started thinking, I think I can do this. Like, this is technical assistance, this is consulting, basically just using all of the information and knowledge and experience that I know works because I've done this before, and sharing that with others. And it was always so exciting to share that information and then see them implement it and then come back and share that success story with me. Yeah, that's probably the best part of the job. But I worked there for, like I said, right at 12 months.
Okay. And so it sounds like a lot of TA for people that are designing
All
diabetes programs.
TA. All TA, absolutely. Yes, I didn't do so on the state level. You don't really do anything with individuals.
Mhm.
So my technical assistance was to organizations that were implementing not CHW, sorry, implementing diabetes education programs. So either what we call DSME, diabetes self-management education program, or DPP, diabetes prevention programs.
Okay. Well, thank you for sharing that. And during your time here, you also got certified as I believe it's both a community health worker and a community health worker instructor. Or it might be just community health worker
Not
instructor.
quite, just CHW instructor. Yes. So here in the state of Texas, you don't have to be one before you can be the other. And there are a couple of ways that you can apply. You can apply based on experience, which is what I did, or you can go through a program like Umemba Health Academy and then become certified. And I'll tell you this story as well. I think this is why it's so great to be open to putting yourself in situations where you kind of expose your knowledge and expertise. So, I'm working as a diabetes nurse consultant, and I pick up the phone, and my team lead says, "Hey, Quisha, the CHW conference is tomorrow, and one of their speakers backed out. Could you throw together a presentation on diabetes, but tailor it to community health workers? It's tomorrow at like 2:00." And at first, I almost said no. I was like, of course, I've got content. I've got nothing but content. That's all I do is do curriculums. And so I did it, and I actually was invited to apply after the presentation because it was so well received. I was invited by the department to actually apply to be a CHW instructor, and the rest is history.
Okay, that is awesome. And with that certification, what types of things do you do, or are you able to do, I should say?
Okay, yeah. So, I have two certifications myself. As an individual, I can teach and train CHWs in the core competencies, but my organization, Umemba Health, specifically Umemba Health Academy, which is our educational arm, is approved to provide certification and continuing education to community health workers. And so we've provided on a number of different, health related topics and just current events like, COVID-19 and pandemic preparedness and emergency preparedness. But our real focus right now is workforce readiness for community health workers and helping community health workers to get a job, to keep a job, or to get promoted on a job. Because one of the things that I've noticed in doing this the last couple of years, that yet there's a lot of public health funding right now to get people trained as community health workers, but that doesn't necessarily equate to them getting a job. And so, yeah, I can go get certified as a CHW, but if I don't know how to do an interview and I don't know how to do a resume and cover letter, if I don't know how to develop a career development plan or even speak to my supervisor and how to articulate my scope of practice and where I stop and the social worker picks up, then how prepared am I for a successful career as a community health worker? So that's really what Umemba Health is focusing on, probably most of this year, but definitely that's our goal 2023 and moving forward.
Okay, I love that. I love that. And you give us a little highlight into what we'll be talking a little bit about in a bit. So you said you were at the job at the Texas Department of State Health Services for about a year.
Mhm.
And then I'm guessing you started president. Well, you were the president and the co-founder in diversity and diabetes, which I'm guessing is what started, what created a conflict of interest. So before you, what was the thought process like before you even started this diversity in diabetes? Well, tell me about that. Where'd that come from?
Okay, yeah, that's a great story, full of great stories. So we moved to Austin. So I got the job offer at the state. The headquarters are in Austin. So we moved from Houston to Austin. And a few months after, I really wanted to get involved with the diabetes space again. So I called or emailed rather the College Diabetes Network and said, I'm in a new state. I'm willing to be an ambassador. You can send me to events, to do outreach and education. And they said, great, we've got a conference coming up in March, and you're welcome to table that event. And so I went to table the event with my co-founder, Casey Creel. She also was an ambassador for the College Diabetes Network. And we were at a conference that was hosted by JDRF, and which used to be Juvenile Diabetes Research Foundation, but I think they just refer to it as JDRF now. And so I told her after a couple of hours of being there, I said, I'm going to walk around, Casey. I'll be back. I'll just, go to the different vendor booths and, go inside and listen to some of the session. Then I'll come back out to the table. So I was walking around and I said, I'm the only Black person here. But there actually was one more. I found one other woman that was a vendor at one of the local hospitals, and I went into the general session and I looked around, and because there were over 200 attendees. I think there were about 13 to 15 speakers, and then there were 50, 51, 52 vendors, somewhere up in there. So then I went to the general session and I looked and I said, there's no Black people at the conference. So then I went and I got one of the agendas and I was looking through and I said, there are no Black people or brown people that are speaking at the conference. So by this time, I'm really kind of put off, for lack of better words. As I'm walking back to the table with the agenda in my hand, I hear Casey, it was a white woman, talking to someone at the next table about the lack of diversity there. And so I said, Casey, oh my God, I was just noticing that just now. So for the next probably 4 hours, we sat at the table talking about why would a condition that's so prevalent in minority communities, why is there no representation as far as speakers? Why is there no representation in diversity of vendors, and certainly in the audience? And so I was just getting ready to travel to Nigeria, but we exchanged numbers. And about maybe 4 weeks later, she's like, are you back? This is Casey. We met at the conference. Are you back from your trip? And I said, yeah. She said, well, hey, we were talking about doing a virtual summit or something. Do you want to do it? And I thought, oh, she was serious, because normally, I'm that person. Yeah, like 90 days later, we hosted our first summit, and we knew pretty quickly, just from kind of the reception that we were getting from others, that this was work that we needed to continue to do. And so we became a 501c3 a few months after that.
And now a quick break from our show sponsor. Do you care about public health and health equity? Have you been looking for value-based apparel? Well, the Public Health Store has got you covered. Rock simple value-based design apparel that will surely have others interested in engaging in meaningful conversations with you. The Public Health Store has apparel for you to rock in class, around the office, or just casually around town. Wear your values where people can see them. Visit the Public Health Store at thephmillennial.com/shop. That's thephmillennial.com/shop. And use the code podcast for 10% off your next order. Okay, now back to the show. That is amazing. And that is astonishing as well, that they didn't have any Black or brown people there, especially considering I believe the diabetes rate is twice for Black people or for Hispanic, Alaskan Natives, and
Yeah.
almost twice for Black people, but compared to whites.
Yeah.
And yeah, I see how important it is for us to show up at these events and then be like, oh, this is not
Absolutely.
right.
Now that's one thing Absolutely. That's one thing I will say. I'm not as bad now, but I remember getting out of grad school and I would go to like sporting events with my kids, or I would go to like, public concerts or something. My mind was in such a, where are the exits? Where are this? Why is the signage not lit up? And so I'm always consistently, wherever I go somewhere, spotting out disparities, spotting out like this is not right. Why do we not have enough representation? Why is there no diversity? Why is there no this or that? And so I think that's for your people that are listening. I think that's one of the blessings and curses of having of getting your MPH, because you're always thinking about things like that and always seeing that.
Yeah, you cannot unsee it now that you know that there are just so many disparities and equities all
Yeah.
around us. It just becomes a little more apparent, that's for sure.
Yeah. Yeah.
Okay, so you all did the summit, started the nonprofit, and what else does the nonprofit diversity in diabetes do?
That's a great question. So our ultimate goal is to create awareness of the lack of diversity and the lack of representation. For instance, I am a certified diabetes care and education specialist, but I'm asked by, women of color of all ethnicities all the time, how did you get into it? How can I get some support? I'm a CDCES and I can't even find a job. I spoke at the conference. I want to say it was in 2019. At that time, there were 4.7% others of like 20,000 CDEs at the time, or CDCES is the new term now. And so that's one of the things we do: create awareness on the diversity and lack of awareness, but also we provide education to individuals. We have a virtual diabetes support group. We have virtual diabetes self-management education. So a lot of what I did as a chief nurse, we do that now in a virtual space as well. We host the annual summit. So we're about to have our third annual People of Color Living with Diabetes Summit, which is always completely free. We have both community members, is what we call people that live and thrive with diabetes, as well as subject matter experts. So nurses, doctors, dietitians, etc., that can speak on a plethora of topics. And again, it's all free. It's for the person with diabetes or the caregiver or the healthcare provider to really be empowered and leave with information. And we've had people, last year we had a diabetes educator. So I've been an educator for 20 years, and I've never learned as much about treating Black and brown patients as I did coming to your summit. So it's stories like that. It's not necessarily the numbers, but it's the qualitative um, um, information that we receive that makes us feel really good about the work that we're doing and the people that we're impacting. So that's what we've done to date. We're looking at ways to embed more care coordination into our model right now, really helping people to access resources, because we know that access to education, access to healthcare is a big problem for people that have diabetes. But we want to do whatever the people want us to do. So we always try to get feedback from our community. We always try to have them inform the direction of our new services and programs.
Yeah, that's truly awesome. And shout out to Casey and yourself for taking it upon yourselves to do this and create that community and that space where there's much needed conversation and everything else. So we appreciate that and look forward to seeing how that all continues to develop going into the future.
Thank you.
You're most welcome. And you're a you were a clinical program training specialist at Caravan Health. So tell me a little bit about how do you come about this position and then what do you do in it?
So remember I told you that my stint at the state short-lived due to a perceived conflict of interest. Umemba Health, which is my public health consultancy, got to a point where there was more attention and people were talking about it. And so again, when you work in positions, federal, state, some local positions as well, if what you do is a perceived conflict of interest, or it's a potential for you to maybe get clients that you know from working in that agency, um, or any other kind of issues like that, then there will be a time where they're like, cease and desist, stop what you're doing, or be terminated. And so it came to that, honestly, with the state. And I remember I cried for 3 days, Amari. I was so hurt because I'm like, I love what I'm doing. I'm really good at finding a need. I see there's a need. There's gaps that need to be filled. I wanted to do it. I did not want to quit my job. And I remember I was so sad and depressed, and I cried for 3 days. And my husband said, "Aren't you a nurse?" And I looked at him and I said, "Oh, I forget." Because one thing, since I've been in public health most of my nursing career, I don't identify as a nurse most of the time. And so once he said that, I said, "Oh, I can go and work anywhere." And so this is what I did. I said, "You know what? First I spoke it, right? I said, I'm going to find a job that's not threatened by my consultancy. Um, and they're going to take me, and they're going to take my business, or they're not going to have me." And that day, I put in my resignation. And I always give a long resignation, so it wasn't like it was anything immediate. I updated my cover letter to include my business. I updated my resume to include my business, and I started applying. And what's Caravan Health have now been acquired by Signify Health, but I applied. And they asked me, "Are you sure you're going to be able to do this? Are you sure you're going to be? What's your contingency plan? What if you grow with your business? How are you going to be able to juggle?" And luckily, I've always juggled. I've always handled multiple things, and so I was able to articulate not only my value, but make them feel comfortable in knowing that I could handle both of those. That I would continue to grow my team if need be, so that I could do that. And yeah, the rest is history.
Yeah, that makes a lot of sense. And shout out to your partner at that time for letting you know that you have this nice credential and you can use it still. You don't have to stay here. Um, but I also think it's important to highlight the point of that you're used to this chaos, quote unquote, in your life, that you're just used to the multitasking, and that has become your norm. I feel like a lot of people in life, they say, "I'm not going to do this because it's chaotic right now," and they search for the perfect conditions to do it. But then if you start in the perfect conditions, when things get hard, you're more likely to stop doing it. So to that
Yeah,
point, just do it now, because there's
just
no there's,
do it. Yes.
there's no
Yeah,
better.
there's no perfect condition. Yeah.
Exactly. And I think that's like a key theme, or just something that resonates about you and in your story. Um,
Mhm.
so what kind of work did you do as a clinical program training specialist?
A lot that I do now. It's one of my probably, yeah, it's one of my favorite jobs. They actually have hired me as a consultant since I left about 12 weeks ago. But I was tasked with developing trainings for internal staff and external stakeholders. I created online courses as well. Sometimes we would work with outside vendors, instructional designers, etc. That's my first time doing voiceover. So there's a lot of workshops and webinars that we have where I am the voice. People may not know that, but I'm the voice behind that particular training. Did a lot of train the trainer. And so Caravan is a value-based care consulting agency. I would train internal staff on our different programs, our clinical programs, and different programs that were being released, and how to implement them with our clients. And then they would go out and implement them with the different ACOs, accountable care organizations. So I got so much experience with writing, with developing, with just the behind the scenes logistics of putting on educational events and e-course. I call myself a self-taught instructional designer. Now I'm working with clients, and I'm working with, things like Articulate, which is an authoring tool for creating online courses. I'm working with video editing software. I'm doing all of these things that nurses don't traditionally do. And I absolutely freaking love it. I love the fact that I've been able to create a lane as a nurse that is so outside of the traditional and ordinary. But I'm able to marry the educational with the public health and with the nursing. And it's just, I don't think I would have been a person that could have picked one or the other. So I'm so glad that I found a path that allows me to do all of them.
That truly, truly is amazing. And I'm super, super happy for you because I know a lot of people search and they can't find or they just don't know how to get to those spots. But you were able to find your way there through the nursing, through the public health, through both of them, through understanding the gaps in the systems. Because it sounds like both in the diversity and diabetes, it's like, okay, there's a huge gap here. Let's fill that gap. And now with Umemba Health, there's a huge gap around community health workers and their education and instruction. And I know that you said that there's one arm around education, which is a member academy. And I'm guessing we're going to talk a little bit more about the other arms of that. So you're a CEO and principal consultant at Umemba Health LLC, and I believe this was like more recently started or more recently formally started. I also want to highlight that's dope that you said that you now consult with Caravan Health. Granted that you were working with them, and I think that's a huge point that a lot of people miss is they want to go into consulting, but a lot of the times, a lot of your consulting clients, initially at least, the people that you've worked with previously. So that just goes to show that. But tell me, what was the thought process around starting Umemba Health, going from
Umemba
corporate
Health.
to Umemba, sorry, and going to corporate, going from corporate to entrepreneurship?
Yeah, so I started Umemba Health working at the state. I remember coming home one day, and Umemba Health is my third attempt at business. So in between my time at the health department, I tried business for myself. I tried doing a partnership. I don't do very good with partnerships. I'm usually very forward thinking and I move really fast. And so waiting on a whole bunch of decisions to be made just does not work in my favor. And so I remember coming home telling my husband, the state is so slow. I'm so bored. I don't understand how people, what is so hard about, because at the time, the organizations that I was consulting with were having a really difficult time incorporating a virtual component of their diabetes education programs. And so you must know I'm a tad bit stubborn. And so I told my husband, I said, I need to start another business anyway. I'm bored. I'm just going to start teaching virtually diabetes education and see what happens. And whatever I figure out when I go to work and I'm consulting with my clients or, the clients of the state, I'll share all my lessons learned. That's basically what I did. So the first 5 months, Umemba Health was a public health education and consulting agency, but I was providing hypertension education, kidney disease education, and diabetes education. Now, wasn't making any money, right? It was 5 months. But I did get up to 5 clients, and I was doing the diabetes prevention program and then my monthly free webinars. Half the time, nobody was showing up, but I would still do the webinar, record it, and not have the content, right? You got to start somewhere. Don't despise humble beginnings. And so one of the things or several things came about that I figured out or I learned the best platforms for providing diabetes education, the best curriculums that would work virtually, which platforms were HIPAA compliant versus which ones that were not, other websites where you could easily, show visual content for interest. For example, I figured out that Pinterest was a really good website if you wanted to share your screen and show, especially if you're doing nutrition education and you wanted to show really colorful examples of how to cook things and teach on recipes and different things like that. So as I'm, figuring this out and playing, for lack of a better word, I'm really finding some things that make a lot of sense for the virtual environment. How to deliver, What makes the most sense? Yes, of course, you can teach someone how to drop insulin and even self-inject virtually. So all these things that I probably should have discovered 5 years ago, because I think I'd probably be rich by now. But I was going then to work with the state and sharing these things with my clients. Then COVID-19 happened. And I remember we were on our way back from Nigeria, and I was revamping my entire business plan. This was 5 months after incorporating my business. And I said, nobody's going to want to come to diabetes class on Saturday. And of course, I was right. Everybody emailed. It was Armageddon, right? Nobody was thinking about diabetes, but I just become a CHW instructor. And I knew, again, finding gaps, finding opportunities. I knew that community health workers were going to need to know how to respond to the pandemic. And so I came back and I emailed about 5 colleagues and I said, do you all have a presentation that you can put together in the next week that's tailored to community health workers? And all 5 of the women were like, sure. And in 2 weeks' time, we did a 5-day free virtual summit for community health workers to help prepare them to respond to COVID-19. Of course, just sharing what we knew at that time, and we know how things were changing every week. And I said to myself, I said to the ladies, if we get 100 people, I'm happy. If 100 people sign up and come, I'm happy. And we had almost 800 people. It was like 760 something sign up. I remember my email list went from like 40 to 800 overnight. And when that happened, I said, I found a niche. I found a niche. And so, yeah. And so the primary, our primary focus now is community health workers. Since then, I've realized that I needed a full educational arm. And so that's where Umemba Health Academy comes into place. So the consulting side of the house does a lot of curriculum development. We do helping organizations apply and maintain their CEs for continuing education. We do, workshops, other facilitation. We do a lot of focus groups or listening sessions. So if a university wants to hire us to conduct that, we help individuals recruit CHWs for surveys and a matter of things. That's the consulting side of the house. But our certification and our continuing education for CHWs is done under Umemba Health Academy.
That makes a lot of sense, and that's awesome that you're able to put together these PowerPoints and say, okay, let's do this training for this like fresh thing that's coming up in public health, in community health worker land, that is you're gonna need information around. And what was the marketing around that? Was it that you just put it on like
social
Eventbrite
media?
or
And then
LinkedIn?
no, we did, it was Zoom. It wasn't Eventbrite. We just, all of the speakers promoted themselves. It was strictly social media marketing, Facebook, Instagram. I was on Twitter at the time. I'm not anymore. Strictly social. I don't even know if I was even utilizing LinkedIn at that point in time, but it was strictly organic, grassroots marketing. And then, one CHW sees it and then they share it with their colleagues and peers. And so, yeah, that's how it happened.
Yeah, absolutely. And like to your point of saying you found your niche, is like, okay, I have these skills, I know what I can do here. Let me see if this is something people are interested in, and people were very, very interested in it. And I think that also like speaking to the progression of everything, that's really cool. And I think it's important for people to understand that you don't have to start doing everything, but like, start doing one thing, and then as the community grows or as the clientele grows, you can really understand where you want to put more effort and stuff like that. So
Yeah.
that makes a lot of sense. Do you have any advice for people that are launching businesses or anything like that in this public health related field?
Oh God. Is one answer, one response? I have tons of advice.
You can give me a couple key points.
One, do it messy, right? So I could have said when it came to that summit, like, oh, I don't have everything in order. Oh, I don't have the branding together. Oh, just do it. do it messy and do it scared. So that's probably the thing that I say the most. Do it scared. It's not going to be perfect. I mean, even now I still have mistakes, grammatical errors and all that stuff like that, but just do it. Get the message out there. For those, I always like to share for individuals that are still working full time like I was, make sure that your employer knows. If you can find one that's supportive, that's even better. That's a rarity. But make sure that you're, because that was one of the things that I did not do, and I realized that was why I had a perceived conflict of interest with the state. So make sure before you try to do any type of endeavor, like, you know, personal business consulting or et cetera, you do have a conversation with your employer. They know where you stand, but just do it. Just do it messy. Do it scared. Yeah, just do it.
Love that, and completely look forward to seeing where Umemba Health goes in the future. I know that you probably have a lot of great ideas, and I look forward to seeing how those
Yeah,
are implemented.
too
And
many.
and I guess you also shared a lot during this interview around like your bread and butter is program planning and implementation, as well as like curriculum development. Do you have any tips that you would share around that for people?
Um, so the bread and butter of my business is CHW training. My jam, like what I love to do, is program planning, implementation. As far as curriculum development, I think the one thing, um, I'll never forget the feeling that I felt when one of my clients said, "Oh, we need you to fill out this sole source form." You know, working in public health, I know exactly what sole source, and I remember thinking, "Oh, Quisha, you're a sole source provider. How did you, you know, how did I even get to this point?" One of the things, I was never scared to do something outside of what I learned. You know, most nurses don't develop curriculum unless you're specifically, you know, a nurse educator. And to do that, you have to have a master's of science in nursing. So that's why I've never been able to teach nurses. Um, you know, I wasn't taught to develop curriculum. I wasn't taught formally, I should say, to be an instructional designer. But those are things that I've never been afraid to learn. You know, I allowed myself to pick that up, and when someone else was absent or could not do it, I allowed myself um, to train myself. And so for me, it's, you know, just because you went to school to get a particular degree in something doesn't mean the learning has to stop there. Like the learning, you can just be a lifelong learner of the world. And I think that being able to have all of these different skills has made me the sole source provider that I am. Like most people don't know, you know, a nurse that's also a public health practitioner, that's also a curriculum developer, that's also, you know, XYZ. So yeah, don't be afraid to expand outside of your comfort of what you were trying to do um, academically.
Love that, love that. So many varied experiences and things that you can do with any type of degree. So
Yeah,
yeah, I appreciate you sharing that.
especially now. Yeah.
Definitely. And before I move you on to the Furious Five, I would like to ask, where would you like to see yourself in the future?
Myself or my business, or both?
Let's say both.
Both. Okay. My business, I want to be known as the premier training agency for CHW instructors. And so you will not hear many people talk about CHW instructors. There only is a formal certification for CHW instructors in Texas. However, again, kind of to the point that I made about there's all this funding for CHWs, but that doesn't necessarily equate to a job. There's such an emphasis on training people to be community health workers, but there's not a lot of emphasis on training individuals to train community
Mhm.
health workers, right? In a lot of states, you'll see CHW programs in community colleges or universities. And so usually it's like an adjunct professor, maybe someone that does have a public health background, but that doesn't necessarily equate to someone that's well versed to train and teach a CHW. And so I feel in the same way that you know, we're very particular about choosing people from the community to serve their community. I also believe we should be that way about choosing people that are teaching and instructing our future our future public health leaders, which is what I like to call CHWs. So that's one thing for my business. I would like that name, that, CHW instructor training to be synonymous with the Umemba Health Academy. As far as myself personally, I'm going into coaching and mentoring others, specifically nurses and public health professionals, or what I like to just put under the umbrella of helping professionals. A lot of people, and I will admit, like, it's kind of an anomaly that I've been able to be this successful in this short of time. And so I know that's not something that happens with everybody and for everyone, but I'm big on mentorship and I'm big on having a coach. I have a coach. I've always had coaches. And so for me, I would like to be more involved in the coaching and mentoring space, especially for individuals that are trying to do something similar that I'm doing. So those are a couple of things I'm looking forward to.
Okay, well, we look forward to seeing how all that unfolds, and people be sure to follow along on social media or wherever else you like to follow along to follow the journey. And then
Awesome.
and then moving on to the Furious Five, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Find something you love and figure out a way to charge for it.
Love it. Love it. Love it. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Just do it. Do it scared. I'm gonna go back to what I said earlier. Just do it. Do your research. Don't harp on it too long. Just do it.
Great advice. Number 3, what's something you are working on improving in your life right now?
Doing less. And so so I have to share this story. A few weeks ago, I told my husband, I was like, I think I'm at capacity. Like, I hate to say that word, but I was like, I think we're already at capacity. And he was like, no, you work for yourself now. You can take on more contracts and just hire more people. Da, da, da. And I said, no, I work for myself now, which means I want to work less. When I worked full time and had my business, I did that out of necessity and survival. But now what I'm working on for myself is I want to work less. And so finding a balance to where, everything gets done, but it's getting done Monday through Friday, 9 to 5.
I love that. I love that for you. That's very, very important. Number 4, professionally, do you recommend anything?
Professionally, you don't need that extra degree. Again, depending what your ultimate or end goal is. I think I mentioned earlier that I did 1 year of a doctoral program. And honestly, Amari, I did it again. I shared the story about wanting to go to med school and didn't do it because I got married and got pregnant young and all that. But I did 1 year and I got straight A's, 1B the first semester, I think 2B's, or a B and an A the second semester. And I was like, I said, I can do this. Do I really need this? And I really had to sit and ask myself, are you doing this because it's something that you've always wanted to do? Or is it something that you're trying to prove to someone else? Like, is it going to get you more money ultimately? And I looked at my student loan balance and I really thought about it. And I said, Quisha, you don't need this. You don't have to appease that little girl, that young lady that got married and have baby early. You can still achieve everything it is you want to achieve with what you have now. You're good just with what you have now. And so again, depending on your end goal, but you don't always need that now certifications, get the certification, but you don't always need that degree.
That is a great perspective, and I think that's something people really need to reflect on and think about, because a lot of the times it is like past mindsets and expectations from others that are really making us do things when we don't necessarily need to do it. And like to that point, it's like you need to be happy with yourself and not regret things because other people, but you make your decisions for yourself.
Yeah.
So thank you for that.
Yeah.
And yeah, number 5, and last but not least, where can people connect with you?
Yeah, at Umemba Health on all social media platforms except for Twitter. And then personally at Quisha Umemba on all social media platforms.
Awesome, awesome. And I'll be sure to link those in the show notes and the descriptions for everyone to connect. But thank you so much, Quisha, for coming on and sharing more about your story and your journey. I think it's very inspiring, and I know that it's going to be helpful for at least one person, hopefully many people.
Thank you so much, Omari.
Thank you. Thank you. Housekeeping items, everyone. Thank you so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like, leave a 5-star review, and share this with a friend so that more people can get out and hear Quisha's great story. Thank you all. See you all next week.